You know, you may have run across mindfulness, and I think it's a measure of where we are in our society and where it sits. That this appeared in the New Yorker in the past year or so. So you know you've hit it big, so to speak, when you're being noted in the New Yorker. So I wanted to talk today about mindfulness and what the heck it is, and create something of a foundation of understanding of what this is and how it might work and how it's helpful and where it fits into this whole world of integrative medicine. And in the afternoon session, we can get into the nuts and bolts of what we do in the program that I teach, a mindfulness-based stress reduction. So I'll make reference to it, but we'll kind of get into more of the details there. But I want you to feel like you have some sense of what this term is that gets thrown around, and to keep this grounded in reality and practice. And so I actually, because it's a hot topic, I think it's something, and we're here in Southern California, we should be doing it, right? So let's just actually do that for a moment. So I encourage you, wherever you happen to be, to take a moment to find a relatively upright posture where you're sitting, where you're able to breathe comfortably. And if you're okay with this, you can allow your eyes to close. If you're uncomfortable with closing your eyes, then just softening your gaze and not focusing on anything in particular. And as you allow your eyes to close or you soften your gaze, just check in with yourself to notice what's here. You might notice sensation in the body of where your body is contacting the surface on which you're sitting, or your feet on the floor. You may notice other sensations, sounds, smells, tastes, thoughts, emotions. And somewhere in the midst of all of that, you might notice breathing happening. And not having to breathe in any particular way, but simply allowing the breath to breathe itself. And each time that your attention might drift from that breath, perhaps bringing it back. Gently but firmly ushering it back to observing the process of breathing. And as you're ready, allowing your eyes to open and bringing your attention back into the room. So, just toss out, what did you notice? Just words, briefly, that you're breathing. I'm sorry? Softening. Expansion. Depth. Sorry? Letting go. Emotion. Gratitude. So I'm just curious, we're all very sort of performance driven. How many of you felt like your meditation that was meditation, by the way, I didn't tell you that, but sneaked it in on you. How many of you feel you were successful? How many of you gave thought to whether or not you were successful? Let's just put it that way. Yeah, so the good news is that if you were paying attention at any point during that practice, you were successful. And it's an interesting thing because we're very interested in achieving things and moving towards goals. And it's very hard to kind of shift us away from that tendency. You know, if you were, I'm guessing that nobody in this room was able to stay focused on the breath the entire, 90 seconds we did that, right? And that's the nature of the mind, right? And we're not, it's one thing that's important to kind of point out what meditation is and what it isn't. And it's not emptying your mind. It's not creating relaxation or opening or any of the other softening, the things that people said. Those things may happen, but they're just an outgrowth of just actually practicing being present. So I want to just kind of work with a bit of a definition here. And the way I like to define mindfulness is as moment-to-moment, non-judgmental awareness. So I want to take that apart just a little bit. So moment-to-moment in the sense that, it's a bit of a cliche, but it's actual reality that we only have this moment to live. We're frequently not in this moment, right? I mean, we have these wonderful brains that allow us to plan out into the future and think back to the past. And those are useful capacities that allow us to be, that make us human, but they also pose some difficulties that we'll talk about. And so we often forget, and we need to be reminded to be brought back to this particular moment, that this is the only place we can actually accomplish anything or do anything or make anything happen is right here. So moment to moment, non-judgmental, and I'll say a little bit about that, and this is not necessarily because mindfulness is about becoming devoid of judgment, but it's really more about becoming aware of judgment. If you were judging your performance when I asked that question, then you were exercising some judgment that may or may not have been helpful to you. If you sat and paid attention and what you noticed was that your mind was all over the place, and then you were sort of thinking, well, gee, I'm not very good at this, I've never been good at this, and this is just like all the other things I'm no good at, you can see where that spiral of judgment creates some suffering for you. And all I did was suggest that you pay attention, right? So we actually create all of our suffering in that manner, in sort of where judgment, I'm having this experience, but I want that one. I ordered the fish, but I really wanted the chicken. Whatever it is, there becomes that judgment that creates suffering. And so when we notice that, then there are times when perhaps we could let go of that judgment and have some relief of suffering. And then the final part, the foundation, is awareness. We have this foundation upon which we can't go anywhere or do anything unless we know where we actually are. And a lot of really what mindfulness practice has to do with is really learning how to get out of our own way. Now that sounds, again, kind of cutesy, but it's actually very important. And actually, as I was listening to some of the talks this morning, I was reminded of something I read not too long ago, a discussion between Andrew Weil and Jon Kabat-Zinn. Jon Kabat-Zinn is the developer of mindfulness-based stress reduction, has written a number of books on it. And I want to just read this one little piece because I think it's relevant to why we're all here. So Andrew Weil says, I've always been interested in the fact that there is a linguistic link between the words meditation and medicine. Both of them arise from a Sanskrit root that also has given us the English word measure. And while it's impossible to pin down the exact meaning of that ancient Sanskrit root, it seems to have to do with thoughtful action to establish order. Implied is a sense of some kind of active process. It's work action of some sort with a goal in mind, and the goal is creating order. So medicine and meditation are both different expressions of that same kind of process in different realms. And then Jon Kabat-Zinn adds, adding to what Dr. Weil has said, I believe the common root to measure has something to do with the Platonic notion of right inward measure. And so medicine is the restoring of right inward measure or order when our health is disturbed in some way, and meditation is, in my mind, the direct perception of right inward measure. Again, we're back to this sort of notion of balance, of inner wisdom, of being able to find our own way. And the basis of mindfulness-based stress reduction and mindfulness teaching in general is this assumption that there is more right with you than wrong with you. And that if, to whatever degree possible, you can get out of your own way and move your conditioning to the side and notice your habits, that you will actually be able to make your way in the world and make choices that are more effective and more beneficial and skillful in various ways. And so that's where we're all sort of coming from here, I think, in different, we're talking about it in different contexts, but we're really restoring this right inward measure. That's our purpose, whether we're doing traditional Chinese medicine or teaching mindfulness or nutrition or practicing allopathic medicine. And Jon Kabat-Zinn's definition is just another way of looking at mindfulness, paying attention in a particular way, on purpose, in the present moment, and non-judgmentally. I think John is wonderful, but I actually like my definition. Kind of cuts to the chase. This just seems a little bit like having to juggle like about 5 different balls in the air at the same time. So really what the active ingredient in what we're doing when we're practicing mindfulness, and I would differentiate mindfulness from meditation. So mindfulness is this ability to be present, this moment-to-moment non-judgmental awareness. Meditation is just the means of cultivating that quality. So there's nothing magic in the practice of meditation. I don't think of, Paul showed the slide of the Buddha levitating. I think it looked like he was doing I've never had that phenomenon happen for me. And so I wouldn't really worry about that sort of mystical aspects of it. But really, this is about practicing non-doing, about being able to see the workings of your mind and not necessarily reacting. And there's some benefits to that we can talk about in a minute. Aware of things coming up, thoughts, urges, whatever, and not necessarily having to succumb to them and act on them just because a thought occurs. So I always like the bumper sticker that says, "Don't believe everything you think." You know? That because your brain offers it up, you can possibly just thank your brain for offering that up and continue on and not have to do anything with it. Think about when you were sitting there, if you noticed an itch. You know, you could have watched that urge to scratch. I'm relatively certain that if you resist that, if you just watch that urge, that, nothing terrible is going to happen. You're not going to burst into flames because you didn't scratch your itch. But that thought to scratch the itch becomes an imperative, and we act on it. Now, that's a pretty benign example, but there are a lot more, more challenging ones. And really, when we come right down to it, what we're talking about in practicing mindfulness, and really, I guess you could say in practicing integrative medicine, is fundamentally changing the relationship we have with the things that we face. Think about that, so that when you have a symptom, that you actually change your relationship with it. Perhaps looking at it in a different way, considering it in a different light. I like to use the example of a headache. When you have a headache, most often you might just go and take an Advil, right? Most of us don't think twice about that. We just do that. Oh, headache, Advil. But we all know in this room that the reason that you got that headache was not because you were low on Advil, right? And that there might be some benefit to pausing long enough to alter your relationship with that symptom of a headache and consider why it's here. Now, you may still take the Advil because that may be what's called for, but you might notice that you're actually dehydrated, or that you're tense, or you have something hormonal going on, or whatever it might be, that there's potentially some benefit to altering your relationship with that symptom and coming at it a different way. And quite often, the people that come to people who are practicing complementary and alternative medicine are people who have encountered something and tried to do it their habitual way, or the way they were used to, and for whatever reason, it hasn't worked. It hasn't achieved the result they wanted, and they've stepped back and said, is there another way to look at this? And then they walk in our doors. So the nice thing is, I think the people that seek us out already have a certain inherent flexibility that gives us and them an advantage, more importantly them, I guess. And we already did the meditation, so I'm going to move ahead. So there have been a few references to our sympathetic nervous system and how it gets us into trouble. And I want to use this example of something that happens. Say someone comes in and dumps something on your desk on Friday at 5. Not someone like your boss, for example, and says, this has to be done, and you were just like right on your way out the door. And so you have this stressful event. And so what we're used to dealing with is this event, our reaction to this thing, it's a threat. Our body interprets it as a threat. We're wired to be able to deal with threat with this sympathetic nervous system. We have fight or flight kicks in, and we have a reaction. Well, we have to do something with that reaction, because in that particular situation I described, neither fighting nor fleeing is probably a good idea, at least for job security. And so you have to do something. You have to contain it in some way. And we all have our ways of coping to contain those sorts of things, because our society and culture doesn't allow us to fight or flee. And we know that some of those coping skills are not as healthy as they could be. Whether it's suppression, or taking it out on your mate, or using drugs, or eating too much, or whatever you might do, your preferred poor coping skill. You can fill that in for yourself. That in order to kind of keep that contained, we internalize those things grind inside of us. We develop habits of dealing with those things, and then those habits become problems that, this maladaptive coping, and you have some maladaptive coping, we all do. You don't have to look sheepish, you're not the only one. Those maladaptive coping skills, whether it's drinking or overeating, have their own problems: heart attacks, arrests, broken marriages, lost jobs, etc. And then those become new stressors, and the cycle continues. And so this little cycle that we're wired to have in order to, it was originally designed to keep us from getting eaten, is now eating us these days, right? So another option would be that when that stressful event happens, that instead of just falling down this cascade in a sort of habitual way, because this is how you always do things, that you actually bring a bit of attention, just like the headache example, that for just a moment you actually stay with difficulty. What a concept. And that there may be some possibility for a different response. And so what we're really talking about is reacting versus responding. So the problem is that we aren't necessarily inclined to stay with difficulty, right? We want to move away from it at all costs. And it's not that there's, this isn't some sort of masochistic process that you're supposed to just plunge into difficulty, but there may be some benefits to just staying put for a moment, keeping, reminding yourself, coming back to your awareness, getting out of your habitual way, and seeing if there's something else that might be done. And that's an unusual process. That's not something that we are sort of habitually prone to do. And so you've probably seen this exercise before, where the instructions are you get this piece of paper with 9 dots, and your job is to take a pencil, place it down on the paper, and draw 4 straight lines that pass through all 9 dots, okay? And if you're like most people, you think, well, that's got to be pretty easy. 1, 2, 3, 4. Whoops, you missed this one. 1, 2, 3, 4, and you missed this one. Well, and some of you probably seen the solution, but let me show that to you. So, right? So again, what the trick was, and usually people, if you don't remember the exact solution, you remember something about thinking outside the box, right? And I know there's something outside the box, and there is this sort of movement outside here. But the funny thing is, there's no freaking box. There's just 9 dots, but our habitual mind puts those 9 dots up there. We immediately make a box out of it and put ourselves in it, and then we're stuck. I've had people in my MBSR classes take half hour, 45 minutes trying to solve this. Now that's a testament to their patience, but not necessarily all that helpful. So this idea of thinking outside the box to potentially stay with difficulty is unusual. So there are times when you might want to think inside the box, and that would be one. So I want to kind of create a visual for you of what happens in meditation. There is no magic to this. Like I said, there's no levitation involved, there's no spells, there's nothing like that. This is really the experience. I tried to create a visual experience of what it's like to be mindful of pain. So let's just say that you're sitting down to meditate and you're aware that you have pain in your knee. It doesn't have to worry right now about whether it's chronic or otherwise. But of course, that beyond just being aware of the pain, we're also aware of the thoughts that come with that pain, not to mention other random thoughts that your brain issues up as well. So you have all these thoughts. So now the field starts to get a little fuller. And then those thoughts, of course, turn to feelings, because we know that these connections are there. And so now the field has got all of these feelings in it, but the thoughts didn't go away. So they're all still there. And now the field gets even more complicated. And this is all stuff just related to pain. It doesn't have to do with the neighbor mowing his lawn and the thought of what you have to do after this and everything else. So when you're using guided imagery, not that there's anything necessarily wrong with it, but the idea is to really just sort of crowd out the bandwidth with an image, or some sort of experience that allows the brain to sort of have a respite from all of this overstimulation. And the challenge, if you've ever talked with someone who has chronic pain in particular about, when you've asked them how was guided imagery for them, they typically have found it to be a pleasant experience while they were actually doing it. The challenge is that you can't live your life while doing guided imagery, and so everything kind of comes back. Now that's oversimplification, and there's other benefits to it, but just to contrast it with what's happening with mindfulness practice, it's something more like this, where everything there sort of fades. It's there, but it is just phenomenon that arises. It's stuff being issued up. The pain is there, the sensation of pain. I like to differentiate in pain between sensation and distress. They're sort of self-explanatory, and in the interest of time, I won't go into it, but just think about that for a moment, because those of us who are not physicians typically can't do a whole lot in terms of the sensation of pain, except perhaps the relaxation for muscle tension pain. But we do, distress is our business, at least in my business. And so there's a lot that one can do with it by changing the relationship with it, by being willing to stay with it and notice these thoughts, but perhaps not get tangled up in them, to not get carried away by that wave. So mindfulness-based stress reduction is this program developed by Jon Kabat-Zinn, who was a PhD in molecular biology at MIT, so naturally he developed a meditation training, right? He's somebody who had a history of yoga practice and meditation and just saw that as a means of relieving suffering. That's was really his experience of it, was to see that there was a way out of suffering, and that it had to do with this ability to stay present. And why not actually apply that in a sort of clinical way, rather than to just see it as a part of a spiritual practice or whatever. And he was working at the University of Massachusetts Medical Center with medical students who have, of course, a bit of stress now and then, and then sort of extended that out, saw that, if this is about relief of suffering, he said to himself, well, I work in a medical center. This is like a suffering magnet, right? Why not bring this to these patients? This is 30 plus years ago now, so it was a more revolutionary than it is now, and began teaching people systematically to practice mindfulness, to contend with stress, pain, and illness. And as Ellen mentioned earlier, it's a sure bet if you call something stress reduction, then it kind of flies below the radar of anyone looking for the, a high woo-woo factor. So that seemed to help. Everyone was willing to admit they have a bit of stress. So the program itself is an 8-week-long program of meditation, some guided practices. Actually, I should take relaxation out of there, although relaxation happens. Some basic yoga and group interaction. And the easy part is that people come for 8 weeks and they come and sit for 2 hours and participate in the group and practice mindfulness. The harder part is that this is not just a technique or a skill. This is an actual way of living one's life. And so we're asking people to practice this every day for a half hour or 45 minutes using guided audio, sitting on the meditation cushion, or doing yoga, or doing some of the other meditation practices to cultivate this fundamental change, this thinking outside of the box in dealing with difficulty. So I want to skate through a little bit, like any kind of good psychological intervention, there's nice evidence of self-reported improvement in quality of life and pain and physical symptoms. Actually, the very first time I heard Jon Kabat-Zinn speak was at Grand Rounds here at UCSD about 15 years ago. And he talked about a study that they did. They were doing their classes in the basement of this building where dermatology had a clinic. And they were doing treatment for psoriasis, which has a major stress component, as some of you are aware. And the treatment is ultraviolet light. Essentially, people were standing naked in tanning booths or light boxes for long periods of time with nothing to do. And so they thought, well, gee, if this is something that helps with stress, why don't we just give these people some modified version of your program while they're just standing there with nothing else to do? And so they gave the folks, half of the folks, these guided practices taken right from the mindfulness-based stress reduction program, and then half were just treatment as usual. And what they actually found at the end was that the folks in the experimental condition that got this sort of just a small component of the MBSR program had significantly fewer and smaller surface area lesions of their psoriasis from having just essentially listened to these tapes and practiced these practices. So that was the first sort of easily measurable, objective sorts of study that was done. There have since been studies of folks looking at immune function. Again, I'm no expert in the details of this, except to tell you that that essentially people who went through this program, these were non-patients here. These were engineers, so they're not necessarily normal, but they're not patients either. So, but that there was significant changes in their response to an immune challenge. Those who went through the program versus those who didn't, and some changes in brain function in sort of areas of activation focusing more on shifting towards more positive affect than negative affect. And there's some other studies that have come out since that have noted cortical thickening in people who are long-time meditators. This is not just for mindfulness-based stress reduction, but actually many years of practice, people actually have thicker areas of the insula and some other areas. I don't think it's, for those of us who are non-technical types, I don't think it's like that you sort of bulk up your insula. I think that it actually preserves thickening over time that is normally, that when you normally have thinning. And I included this not for the specifics, but I actually want to show you, there's a whole series. They did a study with breast cancer patients who were, had a particular level, stage of breast cancer or type of cancer that required surgery but no chemotherapy. And they offered this MBSR course, mindfulness-based stress reduction, to them after post-surgery but before any ongoing like adjuvant therapy of any sort. And what's interesting to me is not the specifics, because I don't understand the specifics necessarily, but that they also had a control group of cancer-free folks that were matched to the participants in the study. Oops. And what happened for them was that essentially what's interesting to me, so this is the cancer-free group, and these are all different markers of immune function. And the darker ones are the people who went through the program, and the lighter bars are the people who were in the control group. And what's most striking is that they're very similar at the beginning, which they ought to be, as Paul was mentioning in regard to his Chamonix study. But that what happened for the people in the MBSR program is they moved towards what normal people experience in sort of every single case, and on the slide before as well, that over the course of participating in this program, they moved closer to normal, where the folks who didn't get it were essentially still hanging out here, in some cases quite a ways from normal. So the way I'm just interpreting this in my sort of simplistic clinical sort of way is that people were able, through this practice, to get out of their own way, to actually to restore that right inward measure, to find some sort of balance through this practice that is actually not just sort of esoteric and abstract, but very concrete, measurable, that they moved towards wellness. And I think that's a pretty big deal. So, I hope I've given you some sort of sense of what this is about. There's a lot to it, and I can talk for hours, but they only gave me 30 minutes. So, as I said in my workshop this afternoon, we'll kind of delve into some of the specifics that happen in MBSR, so you get a better sense of what really takes place in there, and it's a remarkable experience that I'm pleased to have the pleasure on a regular basis to sit with a group of 10 or 15 or 20 people and see them go through this process and discover what they discover. So, and it's been a pleasure talking with you today. Thank you.